All right, we want to turn to other news here this afternoon. 16 and 17-year-olds can now get a booster of the Pfizer COVID-19 vaccine. The FDA has approved emergency use authorization for booster shots for those teenagers, again, 16 and 17-year-olds. The CDC signed off on the change just hours later. Teens can get the booster as long as it's been at least 6 months since their second shot. Well, 15% of healthcare workers say they are hesitant about getting a COVID-19 vaccine. That's according to a new study out of the University of Illinois, Chicago. Those who are hesitant say the biggest influence for them is their coworkers.
And one of the researchers behind that study is joining us now to break down what it is they discovered. Dr. Stephanie Toth-Manikowski, thank you so much for being with us here. This is so surprising for a lot of people, but it is something that we're dealing with throughout the country here. Tell us a little bit about how you came to this through this study and who you included.
Sure. So we surveyed approximately 2,000 healthcare workers at the University of Illinois at Chicago, at Rush Medical Center, and also the Advocate Health System. And, you know, we interviewed all healthcare workers, so physicians, nurses, phlebotomists, clerical, janitorial staff, food service workers. And, you know, some of the findings that we found, I think positive, is that at the time of the survey, which was March, April, and May of this year, 85% of those healthcare workers had been vaccinated, right? So that was a good
amount.
Those are
incredible numbers, yeah.
And then 15%, as you mentioned, of the healthcare workers that were a little vaccine hesitant. We found that those individuals tended to be younger. They tended to be non-physicians. And they also perceived COVID-19 infection a little differently. They didn't seem to be as afraid of COVID-19 infection and its sequelae.
Did they go into explanations as to why they were feeling this way? What role did, you know, social media play, or, you know, other friends, or what kind of information were they hearing that they were feeling hesitant about it?
Sure. So we weren't able to capture all of the details, as many as we wanted to, but what we did see is that people shared a lot of the same concerns that maybe some of the public had at the time, which was, how will this affect my health? Will I have side effects from the vaccine? You know, will I be able to go to work the next day? How will it affect me if I'm planning to get pregnant? You know, and at the time, I don't know that we had all of the answers that we had today. So it did explain some of the hesitancies that they had.
Okay.
This was, you said March and April, so that was really before Delta really took hold, and definitely before Omicron. How do you think that perception is now, given the variants and where we are with this new surge?
Sure. So I think at least vaccine hesitancy amongst in the healthcare workforce hopefully is going to become a thing of the past. The reason I say that is because, at least at UIC, you know, 96% plus of our campus is vaccinated, and I know that Rush and the Advocate Health System have similar numbers, which is great, you know, and so. But when it comes to vaccine hesitancy in the community, obviously that's still a persistent problem.
Yeah, it's ongoing. It's an ongoing one. So as you did your research and you talked to these individuals and saw their responses, I imagine that you probably came up with maybe a few ideas on what we can do moving forward to try to ease some of the concerns and some of the hesitancy that people have. So what is your response? What do you think should be done?
Yeah, I mean, it's a great question. You know, one of the things that we found were, among the people that were hesitant, that were still on the fence about getting vaccinated, one of the things that would help them change their mind was talking to a trusted colleague, maybe a supervisor that had gotten vaccinated. And so I think that's a good step for the public as well. You know, if there are people out there watching tonight that are on the fence, that have questions, you know, it's okay to have those questions, but I would encourage them to reach out to a healthcare professional and ask them about the concerns they have. You know, maybe ask your primary care doctor or a pediatrician, what made you get yourself vaccinated, or why did you vaccinate your children? And talk to them about the concerns that you have. You know, that's why we're here, is to answer those questions.
Talking is key. All right, Stephanie Toth-Manikowski, who did some of this study, you said you were on maternity leave as you were doing it. You thought it was that important.
Yeah,
so, okay.
it was that important. And I want to also point out that more than 99% of the physicians that were surveyed at the time had been vaccinated. You know, so as a doctor, I was really proud to see that myself, my colleagues, advanced care providers, were trying to lead by example.
Thank thank you for the
Thank you
study,
so
and
much.
thanks for sharing it with
Thank you
us
so
here
much.
tonight.
Appreciate it.
All right, moving on here now at 6.